Hey friends, this is April 10th, and I'm just giving an update day after I had conventional therapy yesterday on the 9th, and I had Herceptin and Taxotere. So Taxotere is the chemo, and Herceptin is the HER2 targeting immunotherapy drug. Went well, went great. They did Benadryl IV first. Well, they actually comboed the Benadryl IV now with the anti-nausea and with the low-dose steroid, and did all three together, and I was out and didn't notice anything. And then I woke up, I think, halfway through the Herceptin bag, could feel a little stuff going on, kind of, but nothing bad, kind of just like a little bit of my heart racing. It's kind of what woke me up, but not as bad as the time before, so that was good. Definitely not as bad as that first time. So all went pretty flawless, and I had a friend bring me and drop me home, so that was great. I was still even able to go meet a patient who needed to pick something up at the office, and I went for my acupuncture appointment. So yesterday went really, really well. I was pretty tired that night, so I did fall asleep. Relatively early that night, which was good, and I got up this morning. Not feeling wonderful, just kind of feeling kind of blah. I had some stomach discomfort. Just a little uneasy, so I was a little worried, and so I did cancel my first two appointments I had, and so I did get to make it for the last three, so I had 5 on today, which was probably, I should have probably aimed for 4, but I had 5. So today I actually saw 3, and that went really great. So I felt pretty decent. I was able to work, just trying to keep it on the lighter side. So I did still a lot of my pumps and movements, but 3 hours of work, not shabby. So now I am just going to pull some paperwork together, and I've got a 4 o'clock appointment. So that's kind of like an energy healer type person. So a good way to go internal. So I'm trying to add all the things. So anyway, feeling decent now. I think I've overcome most of the discomfort. So that's a super big positive. I was trying to think of something fun to share today. But I think the fun thing that's a cool topic is that I was just telling a patient about DMSO. And if you don't know about DMSO, which is dimethyl sulfur oxidate, it is a topical. I mean, they have used it internal. This is where I learned about it in one of the Cancer Think Out of the Box Ty Bollinger books. But they used DMSO with another agent. I forget what that one was, but they were thinking the DMSO would just create this systemic movement or this ionophoresis where it draws ions with it, kind of move this other substance toward the cancer cells to attack it. But turns out DMSO actually did the work on the cancer cells, and DMSO doesn't kill cancer cells per se. It converts cancer cells back to normal cells. So it actually sort of gets them to be convinced that they should just be normal again, which is really cool. So topically, this can actually be used. So there was a doctor that I was talking to that knew a guy, but had used DMSO and one drop of iodine on a tumor. She had thyroid cancer. So it had grown so big, and it was too dangerous to do surgery on because it was too close to the carotid artery. So they were basically like, sorry, go home and die. And so her doctor said, no, let's try like DMSO and 1 drop of iodine. And after a month, it was smaller. And after 3 months, it was gone. So another spontaneous remission out there. So topically, it does have the power to do some pretty cool stuff. I have certainly started using this on my tumor since it's right there. So I put DMSO on with 1 drop of iodine, and I work with that. I sometimes add frankincense, which is another really good essential oil that has anti-cancer benefits. In the very beginning, I was doing a lot of frankincense on the roof of my mouth because I was really afraid for this cancer to go to the brain, which it's known for. So we were using that a lot as well. Now I use it still topically. I do it around lymph nodes that I feel sort of swollen. So on this left side, I'll kind of work it. I'll put it into the armpit area or onto the tumor itself. And it smells nice, which is great. But it can go through topically as well, especially with that DMSO. So there's your fun tip of the day. And I hope you guys are all having a wonderful Wednesday. And I hope the rest of my week goes pretty well and that I can continue to do some work and feel decent energy. So wish me luck. Take care. Bye-bye.